Good evening, everyone. My name is Chanel D. Guzman. I'm the Director of Academic Diversity Initiatives for the School of Public Health. And I have to make a disclaimer right off the bat. This green that you see is to spur on spring. I am maize and blue, through and through. Go blue! Woohoo! All right. On behalf of the School of Public Health and our Dean, Martin Filbert, who could not be here with us tonight but extends his greetings, I'd like to welcome you and thank you so much for coming out tonight. I'd also like to acknowledge several people in our audience tonight. In particular, I'd like to tell you a little bit about the context of how this event came to be. As part of the steering committee for the Understanding Race on the LS&A theme semester, our dean charged School of Public Health with coming up with a signature event that represented our discipline. And so the focus on tonight is on health disparities. In the process, we pulled together a great team of people who we'll acknowledge in just a second. And we've been meeting monthly since October. And our meetings have been full of lively conversation. I have spent and planned in 20 minutes at the beginning of each meeting for us to simply get to know each other beyond a superficial or, basic level. So we have delved into understanding race from each other's point of view and perspectives, identity, ethnicity, place, and the feedback that I've received is that this is the first time that they've had an opportunity to formally engage at this level. So we believe this is just the start of something bigger. Also at the School of Public Health, we are engaging in interpersonal dialogue with our group and partner intergroup relations, IGR. So in the fall, we'll be starting more formal processes that relate to helping us to understand each other among our faculty, staff, and students. So we're really excited about that. So at this time, I would like to thank our planning committee. I would ask that our planning committee please stand and be recognized at this time. Thank you so much for your hard work. And I'd also like to especially thank the steering committee. So with that, I also now would like to acknowledge some of our deans and chairs that are with us tonight. The Dean of Academic Affairs is Nancy Jantz. Nancy, will you wave? Mark Zimmerman, who is the Chair of Health Behavior, Health Education. And Anna Diaz-Rue, who is the Chair of Epidemiology. Thank you so much for your support. Now I'd like to take a moment to recognize our co-sponsors for this event. First of all, we have the Senior Vice Provost for Academic Affairs here at the university, Dr. Lester Montz. He is the Arthur Thurnau Professor, Professor of Music, School of Music, Theater, and Dance, and Senior Counselor to the President for the Arts, Diversity, and Undergraduate Affairs. Also would like to acknowledge Ayanna McConnell, who is a Program Director with the Alumni Association for their generous support, Larry Gant from the School of Social Work, and the Understanding Race Project itself for lending us the photo that we use for our advertising. So we're very appreciative of our co-sponsors. We'd also like to just say that as part of this semester, our semester, we took 70 students over to the exhibit itself. So we want to encourage you to view the exhibit on understanding race as you get an opportunity. Our students found a great deal of value in that, and we're very happy that they were able to continue in dialogue. I'd also then like to, thank you so much, John. I'd also like to introduce the epidemiologists behind the statistics. So this collaboration came out of the planning committee deciding to deliver a format in a non-traditional way. We didn't want to do a standard lecture or a standard panel, and so some of our creative people on our planning committee came up with this idea, and we were able to connect with Callie McGee, who is a director of the University of Michigan Educational Theater Company, and you'll hear more about her and her troupe when she comes to the mic. So I'd like to just share a little bit about Adreanne Waller, who is the epidemiologist behind the statistics. Adreanne has an MPH, and she's a 1988 alumna from the University of Michigan School of Public Health. She is currently employed at the Washtenaw County Public Health, WCPH department, as a senior health analyst and epidemiologist. She has held positions at the Michigan Department of Community Health, University of Michigan, and University of Toledo Medical Centers. Her work includes focus on perinatal health, chronic disease, substance abuse, mental health, injuries, environmental health, HIV/AIDS, access to care, Latino health, cancer, and social determinants of health. Her health disparities work at the Washtenaw County Public Health is part of broader initiatives, including the WCPH Health Opportunities Work Group, or HOW, as well as a community partnership grant funded by MDCH titled Capacity Building Grant Partnership to Reduce Health Disparities in Washtenaw County. So before I turn the mic over to Adreanne, I would just like to share a personal reflection that I had during this process. Over the last month, I lost my grandmother. And when one of my dear colleagues gave me a hug of sympathy, as she hugged me, she said, "You know, you've been through so much." Because I have lost several relatives. Back in November, I lost my uncle, who was 58. And he was the last of my father's siblings. So he was basically the last patriarch of our family. And both my father and then his older brother all died really before they were 60 years of age. And so there are various reasons for that, some of which include personal responsibility, some of it includes structural access to care. But it was the first time that I personally felt affected because although they experience the health disparity and they then now become a statistic, they then leave a daughter, they leave a granddaughter, a niece, a cousin. And so that was the first time that I personally felt like, wow, the legacy is affected from generation to generation regarding health disparities. So I hope as you partake of this evening tonight that you will also have your own personal reflections, your own moments of revelation as I have had. It has certainly been a discovery during this whole process, and I just invite you to stay open and to be reflective as we go through this evening. So again, thank you very much for coming, and now I'll bring up to the stage Adreanne Waller. Thank you.
Well, I'm so grateful for all of you, for being here. I see a lot of people I've worked a lot with in this community, friends and family, and also professors who I've used your research to create a lot of what we're going to see tonight. I'm very grateful to the university, to the School of Public Health, and to you that you're spending your time and effort and resources to understand the issues of people, power, and place in Washtenaw County. The faculty in this university research issues from all around the globe, nation, state, and in Washtenaw County. As always, our community is so fortunate to benefit from this dedication of University of Michigan, and specifically the School of Public Health partners, in being willing to wrestle with the complicated issues of its own neighborhood. While Washtenaw County and Ann Arbor are ranked high in many livability, economic, educational, health, and tourism lists, we also have similar problems and disparities that most communities across the country have. However, in many respects, the disparities are in fact more challenging here, as the hills may be a little bit steeper to climb. We're fortunate to have wonderful cities and towns that people flood into each week from neighboring cities and states. However, as a result of that great value, the price that those who are less fortunate pay is sometimes higher. Housing, health care, and other costs of living are typically less manageable for lower income, less educated, and underprivileged in a wealthier community. So tonight, we appreciate that you've taken time to come and see, to understand, and to witness some of the conditions of people, place, and power in which our neighbors and families live. Tonight is really mostly about seeing and listening. The least honor that we can pay one another is simply to be noticed. Tonight, we take the time to not only look at our differences, but also the privileges we have, the privileges that we don't have. Until we understand those things, we cannot hope to move forward with solutions. So what I would like to start with is, it's a photo montage that I've put together over the years. And what I've learned over the years, I've been working for public health for about 25 years, is one of the most useful public health tools is not a computer or public health references or often even working with community. But sometimes the camera is the most powerful tool that we can use. We find that a lot of people that we talk to don't always understand what's going on in our community, and the photographs are a very powerful way to convey that. So what I've done is put together a number of photos, also with the help of a number of students who are here, and you're going to see their names up on the screen, who have also helped drive around in our communities and really look at the contrast between wealth and poverty in our county. And one of the important things to keep in mind is that in our county, urban poverty is pretty easy to see. And lack of privilege in urban areas is pretty easy to see. And the students will attest to this. It's a lot harder to find the rural poverty. But when you find it and you see it, and you also pair that with the epidemiology and the health statistics, you can see why the health of rural citizens has been getting much worse over the last decade. So I would like to get that started. Okay, I just aim anywhere, right? Okay, well, I just wanted to tell you a little bit about this quote. I really appreciate this quote. Alice Miller is a psychologist. I'm not sure if she's still living. I don't think she is. But she survived World War II. She was a Polish Jew, and she did a lot of work with counseling at that time. And I wanted to share this quote with you. I think it really encapsulates a lot of what we're talking about tonight. So one of the things that I think is important to keep in mind when we're looking at health issues is the human habitat. A lot of times we look at behaviors and we look at access to health care and we look at income and those sorts of things. But just like the gerbil and just like the bear and just like the raccoon, humans have a habitat too. And we need to make sure that it's amenable to living. So in our county, when you look from top to bottom, there's a 26-year difference between the oldest and youngest average age of death for blacks and whites in our county, with blacks on the bottom end of that number. This is a map of our county showing the different minor civil divisions, and you can see in the red areas, it's probably hard to see the numbers, but for whites, we see that average age of death goes up to age 85. We look at that same map with the same scale for blacks, and the youngest age, and I even had to add a couple categories here, is as low as 59 to 60 years old. So we've got some real challenges in our county. The average age of death for Ypsilanti Township residents is shorter than the life expectancy for Nicaragua, Honduras, and Bangladesh. So these are the students that have helped: Nicole Allen, Claudia Yvette Sanchez, and Lynette Garcia. And I thank them for their contributions as well. So I'm going to just let this go. That gives you a little bit of a view of our county. For those of you who don't live here, that gives you a little snippet into the contrasts of living conditions in Washtenaw County. For those of you who live here, many of you have probably seen these places, maybe live in those neighborhoods possibly, and I know I was surprised at a lot of the conditions. So I would like to introduce our next portion of our program, and that is the drama portion, and we are so grateful to the Educational Theater Troupe. This is probably the most exciting public health educational event I've ever been to. You're all in for a treat, and these actors are going to teach us a little bit more about health equity in Washtenaw County.
Thank you. Hello, good evening, everybody. What a fabulously large crowd we have. This is fantastic. My name's Callie McKee. I'm the Educational Theater Director with the Office of New Student Programs. And the Office of New Student Programs houses the U of M Educational Theater Company, along with many other programs as well. The U of M Educational Theater Company is comprised of undergraduate students at the University of Michigan. Not all of them, in fact, most of them are not from the theater school. They come from all over campus. We have engineering students, we have residential college, we have all kinds of students from all over. And we're also joined tonight by a School of Public Health graduate student who has joined us for this production and has been a great help in helping us craft our piece. So the piece you're about to see tonight, we were thrilled to be asked to come to work on. It's the first time that we have performed research before. We usually perform for new student orientations. We perform in the College of Engineering. We do sketches on academic ethics, on mental health and college students. We do a lot of different things, but this is the first time that we've used research as source material, and we had actually a lot of fun working on the piece. So I want to thank the School of Public Health and Adreanne for asking us to be a part of this. I'd like to thank Ayanna McConnell, who was the one who connected us with this project in the first place. The students and I have had lots of great conversations around this as well. And the presentation you see tonight will be based on Adrian's research, as well as some other health narratives that we found from around the county, and some of the own experiences of the actors and myself that were in the troupe, and things that came out during rehearsals that we worked on. So I think we have the slideshow switched over now. Yes, we do. There it is. So without further ado, this is a U of M Educational Theater Company. Please join me in giving them a hand.
Morning dress.